Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health Center, and my co-host today is Dr. Ten, and we are reporting for the week of March 1st, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County and Oakland in particular. Alameda County now has over 80,000 COVID cases and 1,242 COVID deaths. And here you can see daily case rates that were coming down nicely for the second half of January and earlier part of February, but seem to have plateaued. And this is also what we are seeing across the nation. And so even though it feels like a bit of a relief that cases have come down, they have not continued to come down as we would have liked to see, and they are actually leveling off at a place that is not particularly reassuring. These are still high daily case rates, and they are seeming to level off in a way that is causing concern that we will have a false sense of security, restrictions will begin to be lifted, and we're concerned that cases may begin to go back up in the wrong direction. So as we are looking at some of the restrictions being lifted, some businesses and schools reopening, we wanted to talk today about how to keep both our homes and our workplaces healthy during COVID. Some of the healthy buildings best practices have not really been widely disseminated up until now. And part of the reason for that is because there has been a little bit of a flip-flopping early on about exactly how COVID is actually transmitted. And we know that COVID is transmitted in a number of ways, primarily through droplet transmission, but also through aerosol or airborne transmission. And this distinction is very important if we are talking about how to mitigate spread, particularly in indoor spaces. And although there was some of that back and forth early on, I think we are all now on the same page, the CDC and the World Health Organization, in saying that we know that airborne transmission is at least partly the culprit. And I think most of us in this work were strongly suspicious that this was the case just by virtue of how rapidly this virus spreads around. There need to always be more studies for us to really determine the percentage of transmission from one mode or another. But as it relates to us putting safety precautions in place, I think it is important that we consider all of the modes of transmission and work to mitigate them all. So healthy building best practices include ventilation, filtration, disinfection and sanitization, occupant masking and spacing, and occupant testing and quarantine when appropriate. Now, ventilation. Ventilation is basically increasing the amount of outdoor air that can come in. And of course, the simplest way to do this where possible is to open up windows. And the more, the better, but even just partially opening windows can be very helpful. Obviously, it's better if we have more windows and if they are on different sides of the room and they can be fully opened. But even opening windows a couple of inches, whether you are in an office or in your car, these are going to improve ventilation significantly. If we are relying on mechanical ventilation, like our HVAC system or central air, then opening up dampers to allow more flow of air would also increase ventilation. Now, it's sometimes difficult to know how much ventilation is happening in a space, particularly if you are just visiting it. You have probably experienced before what we sometimes call sick buildings, or when you're inside of a place for some time and it really doesn't make you feel too well, where we know that circulation or airflow is poor. And even the term sick building kind of came about after a lot of measures were implemented to increase energy efficiency. And so, unfortunately, some of the things that are built in to some of the structures that we live and work in are not necessarily for the best of our health, but are more around energy efficiency. And that is a trade-off and a compromise that we need to be considering as we look to mitigate the spread of COVID indoors. So other than seeing that the windows are open or feeling that the air is on and it's circulating around, how will you know if a space has good ventilation? And this can be hard to ascertain. One thing that some people are suggesting is to utilize a carbon dioxide monitor. Now, sick buildings are not just because of the accumulation of carbon dioxide. It can actually be due to the accumulation of other chemicals and things that can't get out because the buildings are so airtight. But a CO2 monitor will help you determine whether ventilation is good, because CO2 builds up when ventilation is poor. So it's kind of like a proxy for good ventilation. Now, remember, ventilation isn't the only thing that's important in terms of preventing the spread of COVID, but it is one of the things that is very important. So it is not unreasonable to consider purchasing a CO2 monitor, and they have desktop CO2 monitors and portable CO2 monitors. And we've even heard of people taking these with them when they go places just to have a sense of the ventilation. This is by no means perfect. Again, this is just sort of an approximation or a proxy for ventilation. But for reference, outdoors, the background or regular CO2 level is around 250 to 350. So if you're inside and you have a 350 to 500, and this is parts per million of CO2, then you've got pretty good ventilation. Once you get over 1,000 parts per million of carbon dioxide, then this is suggesting that ventilation is poor, and you may even have feelings of drowsiness or other effects of carbon dioxide accumulating in an indoor space. And so this is definitely an indication of poor ventilation. So one consideration is a CO2 monitor. It's definitely not perfect, but it can help you determine whether ventilation in a space is good or not. Now, one thing that's important, and this will be particularly critical if you are involved in setting up spaces where other human beings will be, is the direction of your airflow and how your fan or air circulation is working. And so if you're introducing fans into the equation, in general, you're wanting to pull air from indoors out and ensure circulation of fresh air in. But this is something that really, I think, requires experts in your facilities or operations to determine that you are doing your direction of airflow appropriately, and that individuals are spaced far away from fans, for example, particularly if you are in a situation where there is a potentially infected individual, which again, the point is that we don't know who's potentially infected in these situations. What you don't want is to create a situation where air is blowing across that person and towards other people who are presumably not infected but could become infected. And so this is a very real consideration as you're thinking about the direction of your airflow and your air circulation. And there was a really excellent article that showed the modeling in a graphic representation that I thought was really compelling. And that was on February 26th in the New York Times. Now, I want to mention that opening windows, although it sounds great and obviously logical as it relates to ventilation, there are other considerations. You have noise, you have air pollution, you have extremes of weather, and these are all considerations to think about as we talk about how to increase air ventilation within our indoor spaces. So HVAC, recirculating air, one of the questions we've gotten is, can't that spread COVID around? And this has to do with our next item, which is filtration. So there have been some studies that have found COVID in the ducts of HVAC units, especially when those are attached to, let's say, patient rooms of patients who have COVID, or for example, on some of the cruise ships that had outbreaks of COVID. We don't have proof that HVAC traveled through the ducts and then infected other people. So while COVID was identified within the HVAC system, sort of on the way out, we're not sure if it then spread through the recirculating air. It is possible. There would need to be more studies to really determine that. But the key would be in the filtration and how secure and thorough that filtration is. So for the most part, what's recommended is what's called MERV 13, and MERV just stands for minimum efficiency reporting values. And then of course, there are also HEPA filters, which are an even higher level of filtration. So the MERV 13s filter out about 80% of virus particles, and HEPA filters to actually turn out to filter out about 99.9% of viral particles. They are not as energy efficient though, so this will be a consideration, especially if you're in larger buildings with presumably lower risk. Obviously, clinical settings are going to want to use HEPA filters, but even more important than the filter type is the fit. You can have an amazing filter, but if it doesn't fit properly, then the air and the viral particles will just go right around it. And so I think about this a lot like masks. So you can have the best mask in the world, you can have an N95, but if it's not fitting around your chin and your nose, then the air is just going to bypass it completely, and then the type of mask or filtration you have becomes irrelevant. Same thing with your HVAC systems, and people who are proficient at doing this oftentimes discover that these filters are not fitting properly and the air is just going right around the edges. And they have a smoke test that they can do to actually determine how well these filters are fitting. So again, the fit is even more important than the filtration. At a minimum, you want the MERV 13, and depending on your specific application, you may want the HEPA filters on your HVAC units. So that's ventilation and filtration. Now, what if you don't have windows or HVAC? And this is possible. This is the case in a number of indoor settings. So in that case, what you'll want is a portable HEPA air purifier unit. And again, that HEPA filter is getting about 99.9% of particles, and they are able to filter out particles much smaller than SARS-CoV-2. And I know there's been some debate out there about that. For those who are really interested in this, there's a pretty technical article from NASA here about the efficiency of HEPA filters, and it demonstrates quite clearly that it can filter out particles even much smaller than SARS-CoV-2. Now, the key with both HVAC systems and the portable units is going to be the number of air changes you get per hour. And what is recommended in terms of COVID mitigation is 4 to 6 air exchanges per hour. And some studies have shown that the average home has only half an air exchange per hour. And this may be because we're not keeping on the fan, for example, to keep that air recirculating. And in most cases, hopefully our homes are not a source of concern as it relates to COVID-19. But at any rate, the recommendation is 4 to 6 air exchanges per hour. And how efficient a unit or an HVAC system is at doing this is actually going to depend on a number of factors, including the size of the room. And so this can be a little bit of a complicated equation to do, but luckily on the portable units, they actually do the math for you, and you can see it on the packaging. And it will basically tell you how many air exchanges you get for what size of a room. So it will be important to know what size room you are dealing with. And if you are working with, your HVAC system or wanting to purchase a portable unit, you can also go to, there's an excellent website that is put out by Harvard, and it's about healthy buildings, and it's called forhealth.org. And you can actually plug in the size of your room and other factors and basically determine what kind of air system you would need. So where should you be using portable HEPA filters? Again, I think this is most useful where you really don't have the HVAC and window options. They can be helpful. Again, it's going to depend on the direction of airflow that you're causing with any indoor unit that you place. So again, you'll need some professionals to figure out the placement and how you are maintaining these units. But in general, if you have crowded spaces where you don't have windows and you don't have HVAC, so like an elevator, for example, or maybe even in the bathrooms, remember bathrooms, we actually really don't know whether waste material can spread COVID. We know that it is found in urine and fecal matter. We just haven't proven yet whether it can be spread that way. But knowing that bathrooms are small and typically poorly ventilated spaces, that may be an area that HEPA filters may make sense. And again, the placement will need to be determined by someone who does this professionally for a living, but it's certainly something to consider. All your spaces that are small and poorly ventilated should be examined for potential solutions around ventilation and filtration. And of course, the areas that we've talked about here quite a bit as being high-risk areas, the dining areas, cafeterias, break rooms, those are the spaces where masks come off and people tend to become more social. We need to pay particular attention to ventilation and filtration in those spaces. So now briefly on disinfection and sanitization, I'm not going to spend much time on this because I feel like we pretty much have this one down for the most part. I see no reason to decrease what we're doing or let our guard down. I think we should continue as we have been doing. One of the things I did want to point out, though, is that there's a lot of talk about making sure that we are disinfecting high touch areas. And this is obviously important because you have a number of people touching something and then potentially touching their face. But remember, we are all washing our hands frequently, so we should not be spreading in this manner. And we're also wearing our masks and potentially even eyewear. And so we shouldn't be infecting ourselves in this way. But also, we should remember that because we are talking about droplet transmission and aerosol transmission, even when people are wearing masks, is that these particles and aerosols settle somewhere, and not only on high touch areas. So therefore, we really should be talking about disinfecting all spaces. So yes, disinfect high touch areas frequently, but please don't forget about other surfaces as well. Now, one question we've gotten is, what about barriers, those plexiglass barriers that we see that a lot of people have put up? And plexiglass may have a role, but in general, this is not going to be a good solution. Where we think plexiglass could have a role, for example, in our clinics, we do have some plexiglass in front of maybe a reception station where there is an individual that is sitting at a desk for a whole day, and there are a number of people coming up to that person, and we may be worried about that droplet transmission. And so in that case, it may be useful, but is not doing anything about aerosol transmission, because aerosol, again, is going to go right around any kind of partition like plexiglass. And in fact, with all of what we've talked about in terms of air flow that we are trying to design, the plexiglass partitions could end up actually blocking airflow. So when we think about classrooms or larger meeting rooms, we are actually now saying that those plexiglass partitions may actually impede airflow, and so therefore they may not be a solution in those settings. Now, what about occupancy and spacing? Well, we all know about the 6 feet, and I would say that 6 feet is really an estimate. We know that droplets can travel much further than 6 feet. We also know that aerosol transmission happens. We know that with people in a space together for a long period of time, even with masks on, at some point the air will all fill up and be the same air. So we need that ventilation and filtration, but we need at least a minimum of 6 feet of spacing. And everyone needs to be wearing a mask. And everyone should be wearing a properly fitted mask and a mask that is doing a good job of filtration. Now, remember that all of the math we've done about 6 feet and how many people can be indoors was done on the main strain of COVID that we've been dealing with. But now that we have more infectious variants on the rise, these calculations are going to need to be reconsidered. And so in the meantime, I think we need to think about all of these interventions as layers of intervention. And the more layers that we have in place, the safer we'll be, and the more we'll be able to at least decrease the risk of transmission and spread. And so if I'm wearing a mask and you're wearing a mask and we have good ventilation and we have filtration and we have spacing, then each of those interventions is going to be decreasing the risk, and the risk will still exist. And so how do we identify where there's a risk? And I think that the answer to this is complicated, and it depends a lot on what is going on in the surrounding community. If you are in a community with higher transmission rates, or whether case rates have come down very low. And so these interventions have to do with surveillance, which is basically routine testing, and basically looking to quarantine anyone who is positive and certainly anyone who has symptoms. And this is a topic that we are going to take up in a future briefing about routine surveillance type of testing and when to test and who to test. But for now, I hope this goes without saying, but I'm going to say it anyway. If you have symptoms, you should not be around other people, even for a short period of time. At this point, I would consider it reckless to be around others when you have symptoms of COVID, even for a short period of time, let alone all day in a workplace or a school setting. If you have symptoms, do not gather, do not go to work, do not go to school. Get tested. Get tested immediately if you have symptoms, and isolate yourself until you get your results. And now my co-host, Dr. Tim, will briefly review information and updates on the vaccine thus far.
Thanks, Dr. Noha. I wanted to briefly review the highlights and updates on the vaccine so far that may influence your decision in getting the vaccine, especially as more people become eligible for the vaccine. First off, as a Black physician and as a patient myself, I think it's important to acknowledge our community's history with the medical system. At Roots, we understand the skepticism and caution in the Black community. We get it. Our doctors have looked at the scientific data. We've digested all the information from the studies on the vaccine. And we feel comfortable encouraging our patients to get the vaccine, and we ourselves have been vaccinated too. In previous briefings, we discussed how disproportionate the impact of COVID-19 has been on the Black and Brown community. What I want to do today is share information with you so that you can make an informed decision when deciding whether or not you want to get vaccinated. I want to stress the importance of teasing out inaccurate or false information, especially in this day and age when there's so much misinformation out there. So let's start off with discussing how the vaccine works. I don't want to get too technical, and hopefully this isn't too confusing, so bear with me. First thing is the COVID vaccine is an mRNA vaccine. What does that mean? The mRNA, which stands for messenger RNA, is a code for a protein on the surface of the COVID virus. This protein is harmless to our body. It provides our immune system with a target specific for COVID and not your body. The mRNA, that key component, is carried safely into our cells, and it provides the instructions for your body to make large amounts of this protein. Again, it's found on COVID, but is not COVID. This is similar to how other vaccines work. It essentially allows your body to identify the virus without actually getting the virus. This protein is what allows your body's immune system to defend itself against COVID. There's a lot of misinformation about changing your DNA, but I want to assure you that that is false, and that the mRNA does not alter your DNA. So what's actually in the vaccine? A lot of big words on this ingredient list, but these ingredients are divided into 3 categories. The mRNA, with instructions for the target, lipids, which is a scientific word for fats or cholesterol, and stabilizers. All it is really instructions for the immune system to recognize COVID, and also the ingredients to keep those instructions safe because they're fragile. So how safe is the vaccine? I wanted to start off and emphasize that there has been no deaths because of the vaccine. Over 63 million doses of the vaccine have been given so far. We monitor closely for any side effects that occur after the vaccination. I know there are articles all over social media about folks passing away after the vaccine. However, I want to emphasize that people are still dying from issues not related to COVID, such as heart attacks, strokes. So I'm going to take a second to plug in seeing your primary care doctor to continue to manage any chronic conditions you may have. So I know you all might hear from a friend or of a friend or grandma and grandpa that they felt ill after getting the vaccine. So let's talk about it. All of the symptoms after the vaccine are reassuring signs that the vaccine is working and activating your immune system, which is what we want. Most of these symptoms are not serious and resolved after a few days. You should expect to experience a sore arm and redness around the area where the shot was given, i.e. injection site reactions. And as you can see, a fair amount of people reported fatigue, headaches, and fever. This has not changed even after the first 14 million doses. And you should not be alarmed by these symptoms. And you'll be provided instructions of when to contact your doctor after you receive the vaccine. Most of the symptoms can be managed with hydration, Tylenol, or ibuprofen. So all of these symptoms and reassuring signs of the body's immune system creating a defense against COVID, but how protective is it? Both vaccines, Moderna and Pfizer, have been incredibly effective at doing the things that we care about, like preventing you from experiencing symptoms of COVID, severe disease, and death or hospitalization. We are hoping it also reduces your ability to infect others. However, we're still waiting on more definitive answers. But so far, it's looking reassuring. So who should check in with their primary care provider? As of now, there isn't any medical condition that should prevent you from qualifying and getting the vaccine. There are conditions that require some additional planning and discussions with your primary care doctor or specialist. If you have an autoimmune condition, weakened immune system, or take any medication that affect your immune system, or HIV, you should speak with your doctor prior to getting the vaccine. These conditions can potentially reduce your immune response to the vaccine, and further planning may be recommended, like rescheduling or holding medications that affect your immune system. If you are pregnant, there are still recommendations to get the vaccine. However, pregnant women were not included in studies. Based on how the vaccine works, it is believed to be safe, and vaccine studies on pregnant and breastfeeding women are underway. As we continue to learn more and more about the vaccine and the rollout, including the new Johnson & Johnson vaccine that was just authorized by the FDA, Roots will continue to digest this information and share them with you at the upcoming briefings. Now, back to Dr. Noha.
Thank you for that, Dr. Tim. Now, here's our best advice one more time. Mask, distance, increase ventilation in any indoor space, ensure proper filtration of recirculated air. In the absence of windows or central air, procure a portable HEPA air filtration unit appropriate for your room size. And I will add here that you just need the HEPA air filtration unit. You do not need all of the other features that they sometimes come with, the ionizing and the UV, etc. Those can actually introduce other elements that we don't need and will definitely make the cost go higher. What you need is an air filtration unit that you plug in and you turn it on, and that's it. If you think you're exposed, don't go to work, don't gather. Isolate yourself, get tested in 5 to 8 days. If you have symptoms, get tested right away. Continue to isolate until you get your results. Take a multivitamin supplement and vitamin D supplementation. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.